Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Now, I know we have been going through our antibiotic series, but as promised, I am starting to hit areas that I noticed that y'all frequently have difficulty and questions that I have received and common areas that I've noticed with my one-on-one reviewers that y'all commonly struggle with. I just want to make sure that y'all are getting strengthened in these areas. So you'll notice I'll start to do a pattern of things. And I'll always tell you initially what we're covering, and then you'll start to see videos with me teaching on these things if I don't already have those videos out for you, but to reiterate some of this stuff for you. So we're going down hypertension path this week, okay? Just making sure that you fully understand it, understand all the scenarios, and know how to navigate and work through each of these potential avenues that may be presented with hypertension, okay? All right, so let's get into question number one. Question number one states a 47-year-old male presents to the office for his annual appointment. The patient denies any complaints at this time. Upon examination, the nurse practitioner notes that his blood pressure is 128 over 84 today. What are the next best steps at this time? Is it A, continue to monitor the patient is healthy and no treatment is warranted? Is it B, chlorothalidone? C, implement lifestyle modifications to include a DASH diet and exercise? Or D, lisinopril? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as this allows you to slow down to ensure you're answering what is being asked, right? So here, the stem of the question states, what are the next best steps at this time? Now, all right, so this is more of a priority style, number one. You got to gauge what steps we're even talking about. And pay attention anytime it says next best. I don't care if something else in the answer choices are correct. You need to pick what is the next best thing you should do. So, what is the priority, right? And you probably remember this from NCLEX, but priority style questions. Pay attention to that stem so that you are following along on the right path. Okay. Then, so we need to take it back from the top. I always tell y'all to look at their age, their gender, their ethnicity, because that can play a part hugely in the diagnosis process, how to treat, when to treat, what to treat with, right? So, all right. So, a 47-year-old male presents to the office for his annual appointment. So, it's a male, he's 47. The patient denies any complaints this time. So, okay, everything is good. On exam, the nurse practitioner notes that his blood pressure is 128 over 84. Okay, so you're probably thinking not too terrible. But I also want you to process your way through, okay? So, do you want to just continue to monitor the patient is healthy and no treatment is warranted? No, we never sit and say we're not going to do anything, right? There needs to be some type of steps because this is not a normal blood pressure. Anything over that 120 over 80, going off of our ACC and AHA guidelines, states that this is pre-hypertension, right? So with pre-hypertension, what do? We implement lifestyle modifications like our DASH diet, exercising for 30 minutes at a time for 5 days a week, right? Or if it's more of a high intensity exercise, you can do 75 minutes instead of the 150 for the week, right? So you can cut that in half. So in this scenario, one, B, and D, we haven't reached a point where we need to start medications, but we are to that tier where you want to implement the lifestyle modification. So C is your best answer. So remembering again, if it's 120, if it's over 120 over 80, but we haven't exceeded that 130 over 90 range, the lifestyle modifications are in place. All right. But follow me as we continue through the questions and we'll go into the next steps. Okay. Question number two: a 36-year-old female returns to the office today for follow up. The patient denies any complaints at this time. She has a past medical history of COPD and diabetes. She currently takes albuterol PRN and metformin 500 milligrams daily. Upon examination, vital signs are blood pressure 134 over 92, respirations are 20, the pulse is 88 beats per minute, and the temperature is 98.6 degrees. Based on these findings, how should the nurse practitioner treat? Is it A, you want to initiate lifestyle modifications and chlorothalidone? B, initiate lifestyle modifications and lisinopril? C, initiate lifestyle modifications and Norvasc? Or D, initiate lifestyle modifications? Take a moment and tell me what you got, y'all. And tell me what you got in the comments because a lot of y'all have been having difficulties with this. And as you practice and do these things, it allows us to, one, notice where your gaps are, and for me to help you if I see that you're having any issues. All right, so the stem of the question here states, based on these findings, how should the nurse practitioner treat? Remember, I tell y'all, if they're asking for a treatment, you need to run it back, see if they provided you with a diagnosis, and if they have not, take it a step further and look at the assessment findings. So here, not so much of a diagnosis. Let's see what's going on. So again, we're starting from the top. Look to see if they provided you with an age, a gender, an ethnicity, because all these things can tie into how you need to maneuver, right? So a 36-year-old female returns to the office today. So a 36-year-old woman, right, female. The patient denies any complaints at this time. She does have a past medical history of COPD and diabetes. You want to put that to the side also. So past medical history, allergies, I always talk about that. Make a note, highlight it, whatever you need to do, because you need to save that, because that's also tiers to help you decide how to maneuver, right? She currently takes albuterol, PRN, metformin daily, and we're looking at vital signs, right? Blood pressure is the only one that really stands out. Her blood pressure is 134 over 92. So a few things. Again, knowing your guidelines and your tiers on when we need to move forward with certain things, right? So if based on ACC and AHA guidelines, if they have comorbidities, their goal is to not exceed 130 over 90, right? Clearly, this patient is exceeding this, and she has comorbidities as she has a past medical history of COPD and diabetes, right? And just think about it. We don't want this to go any higher with people who have comorbidities because they already have risk factors. So if you have and more increased blood pressure on top of that, you're increasing the risk of heart disease, right? So we're trying to limit this and manage this accordingly. So again, anytime someone has comorbidities, the goal is for them not to exceed 130 over 90. If they do, we go ahead and initiate medication therapy, right? And I always tell y'all when we're doing blood pressure, you need to know when first. So, when do we treat? Then know how to treat, right? So, here we know we need to treat at this point, right? So, how do we treat this population? Is it A, initiate lifestyle modifications and chlorothalidone? Could potentially be, but let's think about that. Initiate lifestyle modifications and lisinopril. This is your better answer, and let's talk about why. One, we want to initiate lifestyle modifications because this has not been implemented yet, but also this person has diabetes. Remember, in our diabetic patients, you want to go ACE or ARB as they are renal protective. So I always say, because this is the major hurdle that y'all run into. When it comes down to those medicines, you get mixed up on which one should go first. And I say, think of the starting four. This is the starting four on your team, right? On the first line therapy. They all going in first. They can all go in first, but you need to know which one for what, right? So we have our thiazides, we have our ACEs, we have our ARBs, we have our calcium channel blockers. Those are the most common starting four, with thiazide being the lead, the captain, the top. So unless you have to rule out a thiazide, the thiazide goes first, right? All right. Now, if they are diabetic, have kidney issues or something that warrants renal protection, then we go with an ACE or ARB. They're not going to put both on there if that's the case because you can use one or the other, right? So here, B is your best answer. You want to initiate your lifestyle modifications and lisinopril because they are diabetic. We need renal protection. And remembering Know your endings. Pril is an ACE inhibitor, right? Norvasc would have been a calcium channel blocker. We don't need that. Chlorothalidone, we skip that in this equation because of the diabetes, right? All right. And question number 3, you guys. A 24-year-old African American male patient presents to the office today for follow up. He presents with a blood pressure log so that we can review after 1 month of implementing lifestyle modifications. Blood pressure log shows systolic readings ranging from 142 to 148 and diastolic readings ranging from 90 to 92. He does not have any past medical history. Listed allergies consist of penicillins, sulfonamides, and shellfish. Based on these findings, how should the nurse practitioner treat? Is it A, initiate chlorothalidone, B, initiate lisinopril, C, initiate amlodipine, or D, initiate losartan? Take a moment and tell me what you got, you guys. All right, so similar question here states, based on these findings, how should the nurse practitioner treat? Again, we're thinking about treatment. You want to run it back and see if they provided you with a diagnosis. If they have not, run it back a step further and look at those assessment findings so that you can determine the diagnosis. And as you're working through questions, you know the steps. Have they provided you with age, gender, ethnicity? Because these can tie into things, right? So the diagnosis is not here. The patient is here for follow up so that we can review these blood pressure logs to see if, since these lifestyle modification has been implemented, that the blood pressure is more controlled. Let's see what's going on. It's a 24-year-old. They're African American and male. So those are the 3 tiers that we need to keep in mind. Um, the systolic readings are ranging 142 to 148, diastolic 90 to 92. We know that's not is not good in any scenario, right? So at any moment they can be 142 over 90, 148 over 92. All of those things are, abnormal. And then again, when we're thinking about ACC and AHA guideline, now that we have gone through the tiers, let's talk about this one. So initially 120 over 80. If it exceeds this, it's considered pre-hypertension, right? If they have comorbidities, their goal is we do not want them to exceed 130 over 90. And in our healthy population, we do not want them to exceed 140 over 90. Of course, we don't want you that high anyway, but you have more room for an elevated blood pressure when you don't have other risk factors. So once it starts to get above 140 over 90, we need to initiate medical therapy, right? Medication therapy. All right, so we know here this patient is going to need some type of medication therapy. But let's see if we need to consider anything else. So he doesn't have a past medical history. All right, good. He does have some allergies, penicillin, sulfonamides, and shellfish. All right, so let's see what we have. Do we want to initiate chlorothalidone? Remember your starting 4. He doesn't have past medical histories, and we could go with chlorothalidone because our thiazides is the captain, it's the top of the starting 4 on our first line therapy for blood pressure, right? But pay attention to the allergies. He has an allergy to sulfonamides. Remember, if they have a sulfur allergy, you don't want to give thiazides. If they have gout, you don't want to give thiazides. So we can cross thiazides out. We really don't need to go with an ACE or R because he doesn't have any risk factors, doesn't really require renal protection. Also, remember what we talked about in the beginning. His ethnicity, his background, he is an African American male, right? In the African American population, we know that thiazides and calcium channel blockers are the best um, anti-hypertensive medications. African American population responds better to thiazides and calcium channel blockers, and it's also shown that they respond better to those in combination, like with both, right? But so that means now our starting 4 is really a starting 2 for the African American population. Thiazides, calcium channel blockers. We already ruled out using a thiazide because of the sulfonamide allergy, right? So that means that we need to go with a calcium channel blocker, right? So here, C, initiate amlodipine. Amlodipine is a calcium channel blocker. Pine is how majority of our calcium channel blockers end. Okay, so make sure you familiarize your medications in those groups, and remember when to treat and then how to treat. Now, I want to just run through that really quickly on the when to treat, how to treat, and if you struggle with it, I will link my hypertension video in the description so that you can watch the full breakdown as I talk through it to kind of help you guys. But remember, ACC and AHA guideline, which is what all exams are testing on, and have been for some time now. But ACC and AHA guidelines say when, okay? When to treat and how to treat is how I like to break it down for y'all. When we treat, if their blood pressure exceeds 120 over 80 but does not exceed 130 over 90, that is pre-hypertension. Start your lifestyle modifications. If they have comorbidities and their blood pressure exceeds 130 over 90, initiate medications. If they are healthy and their blood pressure exceeds 140 over 90, initiate medications. So go through those steps anytime we're talking blood pressure. What is that blood pressure? Do they have comorbidities? And work your way through, okay? Now, so because if they exceed any of those, we're going to need to do something. We're going to have to initiate something. Then you need to know how to treat them, right? Remember your primary starting four are your thiazides, your ACEs, your ARBs, your calcium channel blockers, with thiazides being the captain, the top of the first line starting four crew, right, of your lineup, and then you work your way through. If they need renal protection, like chronic kidney disease, diabetics, etc., you can use an ACE or ARB for those renal protective measures. And if they're African American, we're going with the thiazide or a calcium channel blocker. Know how to work your way through, okay? And we'll continue to go through these this week so I can give you different scenarios and help you start to formulate these things in your mind a little bit better, okay? But as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one at gmail.com. The things that I do offer are my review book, both ebook and paperback option. They're linked in the bio of this channel. If you're looking to do any practice questions, that is also linked in the bio of this channel. If you prefer to study independently, my self-paced review for family and adult Gero is also linked in the bio of this channel. And then if you're looking to book any one-on-one sessions, I always say to reach out to us. You can either call, text, or shoot an email so that I can gauge what you truly need. As our one-on-one sessions are customized, and I like to gauge and make sure that you are selecting the one-on-one option that suits your learning styles and what you truly need to be successful on boards. All right, you guys, if y'all know what to do, make sure y'all meet me back here. Happy studying. Bye, y'all.